Welcome to Explain Wise 91. Happy holidays and seasons greetings. In today's video, we bring you 50 pharmacological and parenteral therapies, drug classes, drug side effects, dosage calculations, for/med administration safety. Nursing MCQs to help you sharpen your knowledge and boost your exam performance. Stay focused, think critically, and test your mastery as we dive into these essential nutrition concepts. Let's get started. Question 1. A provider orders morphine 8 mg for push. Available, morphine 10 mg per milliliter. How many ml will the nurse administer? A. 0.6 milliliters. B. 0.8 milliliters. C. 1 milliliter. D. 1.2 milliliters. Correct answer, B. 0.8 milliliters. Rationale. Use the formula, dose ordered / dose available times volume equals 8 mg / 10 mg times 1 milliliter equals 0.8 milliliters. Strategy. Always use dimensional analysis or formula method for accuracy. Why other options are not correct? A. Incorrect calculation. C. D. Overdose, potentially life-threatening. Question 2. A client is prescribed heparin 5,000 units subcutaneously. Available, heparin 10,000 units /ml. How many ml should the nurse administer? A. 0.25 milliliters. B. 0.5 milliliters. C. 1 milliliter. D. 2.0 milliliters. Correct answer, B. 0.5 milliliters. Rationale. 5,000 units / 10,000 units times 1 milliliter equals 0.5 milliliters. Strategy. Double-check heparin doses, high-alert medication. Why other options are not correct? A. Underdose. C. D. Overdose, risk of bleeding. Question 3. A child weighing 20 kilograms needs acetaminophen 15 milligrams per kilogram. How many mg should the nurse administer? A. 200 milligrams. B. 250 milligrams. C. 300 milligrams. D. 350 milligrams. Correct answer, C. 300 milligrams. Rationale. 15 milligrams per kilogram times 20 kilograms equals 300 milligrams. Strategy. Always calculate pediatric doses based on weight. Why other options are not correct? A. B. Underdose, inadequate pain relief. D. Overdose, risk of hepatotoxicity. Question 4. A client is receiving dopamine at 5 micrograms per kilogram per minute. The client weighs 80 kilograms. The concentration is 400 milligrams in 250 milliliters D5W. What is the flow rate in ml/hr? A. 10 milliliters per hour. B. 15 milliliters per hour. C. 20 milliliters per hour. D. 25 milliliters per hour. Correct answer, B. 15 milliliters per hour. Rationale. 5 micrograms per kilogram per minute times 80 kilograms equals 400 micrograms per minute equals 0.4 milligrams per minute. 0.4 milligrams per minute times 60 minutes equals 24 milligrams per hour. 400 milligrams / 250 milliliters equals 1.6 milligrams per milliliter. 24 milligrams per hour slash 1.6 milligrams per milliliter equals 15 milliliters per hour. Strategy. Convert units systematically McG to mg, min to hr. Why other options are not correct? A. Underdose. C. D. Overdose, risk of vasoconstriction injury. Question 5. A provider orders 1 L of NS to infuse over 8 hours. What is the flow rate in ml/hr? A. 100 milliliters per hour. B. 125 milliliters per hour. C. 150 milliliters per hour. D. 175 milliliters per hour. Correct answer, B. 125 milliliters per hour. Rationale. 1000 milliliters slash 8 hours equals 125 milliliters per hour. Strategy. Convert liters to ml before calculating. Why other options are not correct? A. Underdose, inadequate hydration. C. D. Overdose, risk of fluid overload. Question 6. A client needs vancomycin 15 mg per kilogram for. The client weighs 70 kilograms. How many mg should be administered? A. 950 milligrams. B. 1000 milligrams. C. 1050 milligrams. D. 1100 milligrams. Correct answer, C. 1050 milligrams. Rationale. 15 milligrams per kilogram times 70 kilograms equals 1050 milligrams. Strategy. Weight-based dosing ensures therapeutic levels. Why other options are not correct? A. B. Underdose, risk of treatment failure. D. Overdose, risk of nephrotoxicity. Question 7. A provider orders insulin regular 10 units for bolus. Available, insulin regular 100 units /ml. How many ml will the nurse administer? A. 0.05 milliliters. B. 0.1 milliliters. C. 0.5 milliliters. D. 1 milliliter. Correct answer, B. 0.1 milliliters. Rationale. 10 units /100 units times 1 milliliter equals 0.1 milliliters. Strategy. Always use an insulin syringe for accuracy. Why other options are not correct? A. Underdose. C. D. Severe overdose, risk of hypoglycemia. Question 8. A client is receiving nitroglycerin 10 micrograms per minute. The concentration is 50 milligrams in 250 milliliters D5W. What is the flow rate in ml/hr? A. 2 milliliters per hour. B. 3 milliliters per hour. C. 4 milliliters per hour. D. 5 milliliters per hour. Correct answer, B. 3 milliliters per hour. Rationale. 10 micrograms per minute equals 0.01 milligrams per minute. 0.01 milligrams per minute times 60 minutes equals 0.6 milligrams per hour. 50 milligrams /250 milliliters equals 0.2 milligrams per milliliter. 0.6 milligrams per hour /0.2 milligrams per milliliter equals 3 milliliters per hour. Strategy. Convert McG to mg for calculation accuracy. Why other options are not correct? A. Underdose. C. D. Overdose, risk of severe hypotension. Question 9. A child weighing 15 kilograms needs amoxicillin 50 milligrams per kilogram per day divided into 3 doses. How many mg per dose? A. 200 milligrams. B. 250 milligrams. C. 300 milligrams. D. 350 milligrams. Correct answer, B. 250 milligrams. Rationale. 50 milligrams per kilogram per day times 15 kilograms equals 750 milligrams per day. 750 milligrams / 3 doses equals 250 milligrams per dose. Strategy. Calculate daily dose first, then divide. Why other options are not correct? A. Underdose. C. D. Overdose, risk of toxicity. Question 10. A client is prescribed digoxin 0.25 mg PO. Available, digoxin 0.125 mg tablets. How many tablets should the nurse administer? A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Correct answer, B. 2 tablets. Rationale. 0.25 milligrams / 0.125 milligrams per tablet equals 2 tablets. Strategy. Always check apical pulse before digoxin administration. Why other options are not correct? A. Underdose. C. D. Overdose, risk of toxicity. Question 11. A provider orders potassium chloride 40 milliequivalent 4 in 100 milliliters NS over 2 hours. What is the flow rate in ml/hr? Of 40 milliliters per hour. B. 50 milliliters per hour. C. 60 milliliters per hour. D. 70 milliliters per hour. Correct answer, B. 50 milliliters per hour. Rationale. 100 milliliters / 2 hours equals 50 milliliters per hour. Strategy. Never give potassium 4 push, always dilute and infuse slowly. Why other options are not correct? A. Too slow. C. D. Too fast, risk of cardiac arrest. Question 12. A client weighing 60 kilograms needs gentamicin 1.5 milligrams per kilogram for. How many mg should be administered? A. 75 milligrams. B. 85 milligrams. C. 90 milligrams. D. 100 milligrams. Correct answer, C. 90 milligrams. Rationale. 1.5 milligrams per kilogram times 60 kilograms equals 90 milligrams. Strategy. Monitor renal function, gentamicin is nephrotoxic. Why other options are not correct? A. B. Underdose, inadequate infection treatment. D. Overdose, risk of nephrotoxicity. Question 13. A provider orders 500 milliliters NS to infuse over 4 hours. The 4-tubing drop factor is 15 GTT/ml. What is the drip rate in GTT/min? A. 25 GTT/min. B. 31 GTT/min. C. 38 GTT/min. D. 42 GTT/min. Correct answer, B. 31 GTT/min.
Rationale.
500 milliliters times 15 GTT/ml/ per hours times 60 minutes equals 31.25 is almost equal to 31 GTT/min.
Strategy. Round to nearest whole number for drip rate.
Why other options are not correct? A. Too slow, inadequate hydration. D. Too fast, risk of fluid overload.
Question 14. A child needs ibuprofen 10 mg per kilogram for fever.
The child weighs 25 kilograms.
Available, ibuprofen 100 mg per 5 milliliters. How many ml should the nurse administer?
A. 10 milliliters. B. 12.5 milliliters.
C. 15 milliliters. D. 17.5 milliliters.
Correct answer, B. 12.5 milliliters.
Rationale.
10 milligrams per kilogram times 25 kilograms equals 250 milligrams. 100 milligrams/5 milliliters equals 20 milligrams per milliliter. 250 milligrams/20 milligrams per milliliter equals 12.5 milliliters.
Strategy. Always verify pediatric liquid medication concentration.
Why other options are not correct?
A. Underdose. D. Overdose, risk of GI bleeding. Question 15.
A client is receiving heparin 1,200 units/HR.
The concentration is 25,000 units in 500 milliliters. What is the flow rate in ml/HR?
A. 20 milliliters per hour. B. 24 milliliters per hour. C. 28 milliliters per hour.
D. 32 milliliters per hour.
Correct answer, B. 24 milliliters per hour.
Rationale. 25,000 units/500 milliliters equals 50 units/ml. 1,200 units/HR/50 units/ml equals 24 milliliters per hour. Strategy. Always monitor APTT with heparin infusion.
Why other options are not correct?
A. Underdose. D. Overdose, risk of bleeding. Question 16. A provider orders ceftriaxone 1g4. Available, ceftriaxone 2g vial. Reconstitute with 10 milliliters sterile water. How many ml should the nurse administer? A. 3 milliliters. B. 4 milliliters. C. 5 milliliters. D. 6 milliliters.
Correct answer, C. 5 milliliters.
Rationale.
2g/10 milliliters equals 0.2g/ml. 1g/0.2g/ml equals 5 milliliters.
Strategy. Always check reconstitution instructions on vial.
Why other options are not correct?
A. B. Underdose. D. Overdose. Question 17. A client needs enoxaparin 1 mg per kilogram subcutaneously. The client weighs 80 kilograms.
Available, enoxaparin 100 mg per milliliter.
How many ml should the nurse administer?
A. 0.6 milliliters.
B. 0.8 milliliters. C. 1 milliliter. D. 1.2 milliliters.
Correct answer, B. 0.8 milliliters.
Rationale. 1 milligram per kilogram times 80 kilograms equals 80 milligrams.
80 milligrams / 100 milligrams per milliliter equals 0.8 milliliters.
Strategy. Rotate subcutaneous injection sites. Why other options are not correct? A. Underdose. C. D. Overdose, increased bleeding risk. Question 18. A provider orders D5W 1000 milliliters to infuse over 12 hours. What is the flow rate in ml/hr? A. 75 milliliters per hour. B. 83 milliliters per hour. C. 90 milliliters per hour. D. 100 milliliters per hour. Correct answer, B. 83 milliliters per hour. Rationale. 1000 milliliters / 12 hours equals 83.3 is almost equal to 83 milliliters per hour. Strategy. Round to nearest whole number for pump settings. Why other options are not correct? A. Too slow. C. D. Too fast, risk of fluid overload. Question 19. A child weighing 12 kilograms needs ceftriaxone 75 milligrams per kilogram for. How many mg should be administered? A. 800 milligrams. B. 850 milligrams. C. 900 milligrams. D. 950 milligrams. Correct answer, C. 900 milligrams. Rationale. 75 milligrams per kilogram times 12 kilograms equals 900 milligrams. Strategy. Verify safe pediatric dose range before administering. Why other options are not correct? A. B. Underdose, inadequate infection treatment. D. Overdose. Question 20. A client is prescribed warfarin 7.5 milligrams PO. Available, warfarin 5 milligrams tablets. How many tablets should the nurse administer? A. 1 tablet. B. 1.5 tablets. C. 2 tablets. D. 2.5 tablets. Correct answer, B. 1.5 tablets. Rationale. 7.5 milligrams / 5 milligrams per tablet equals 1.5 tablets. Strategy. Monitor INR regularly with warfarin therapy. Why other options are not correct? A. Underdose. C. D. Overdose, bleeding risk. Question 21. A provider orders regular insulin infusion at 8 units/hr. The concentration is 100 units in 100 milliliters NS. What is the flow rate in ml/hr? A. 6 milliliters per hour. B. 8 milliliters per hour. C. 10 milliliters per hour. D. 12 milliliters per hour. Correct answer, B. 8 milliliters per hour. Rationale. 100 units/100 milliliters equals 1 unit/ml. 8 units/hr/1 unit/ml equals 8 milliliters per hour. Strategy. Monitor blood glucose hourly during insulin infusion. Why other options are not correct? A. Underdose. C. D. Overdose, risk of hypoglycemia. Question 22. A client needs furosemide 40 milligrams for. Available,
furosemide 10 milligrams per milliliter. How many ml should the nurse administer? A. 2 milliliters. B. 3 milliliters. C. 4 milliliters. D. 5 milliliters. Correct answer, C. 4 milliliters. Rationale. 40 milligrams / 10 milligrams per milliliter equals 4 milliliters. Strategy. Administer 4 push slowly, no faster than 20 milligrams per minute. Why other options are not correct? A. B. Underdose. D. Overdose. Question 23. A child weighing 18 kilograms needs phenytoin 5 milligrams per kilogram for loading dose. How many mg should be administered? A. 75 milligrams. B. 85 milligrams. C. 90 milligrams. D. 100 milligrams. Correct answer, C. 90 milligrams. Rationale. 5 milligrams per kilogram times 18 kilograms equals 90 milligrams. Strategy. Infuse phenytoin slowly to prevent hypotension. Why other options are not correct? A. B. Underdose, inadequate seizure control. D. Overdose, risk of toxicity. Question 24. A provider orders 250 milliliters of packed RBCs to infuse over 2 hours. What is the flow rate in ml/hr? A. 100 milliliters per hour. B. 125 milliliters per hour. C. 150 milliliters per hour. D. 175 milliliters per hour. Correct answer, B. 125 milliliters per hour. Rationale. 250 milliliters / 2 hours equals 125 milliliters per hour. Strategy. Monitor vital signs every 15 minutes for first hour. Why other options are not correct? A. Too slow. C. D. Too fast, risk of transfusion reaction. Question 25. A client is receiving dopamine 400 milligrams in 250 milliliters at 15 milliliters per hour. How many mg/hr is the client receiving? A. 20 milligrams per hour. B. 24 milligrams per hour. C. 28 milligrams per hour. D. 32 milligrams per hour. Correct answer, B. 24 milligrams per hour. Rationale. 400 milligrams / 250 milliliters equals 1.6 milligrams per milliliter. 15 milliliters per hour times 1.6 milligrams per milliliter equals 24 milligrams per hour. Strategy. Use this to verify ordered dose matches infusion rate. Why other options are not correct? A, C, D. Incorrect calculations could lead to dosing errors. Question 26. A provider orders amoxicillin 500 milligrams PO. Available, amoxicillin 250 milligrams per 5 milliliters. How many ml should the nurse administer? A. 5 milliliters. B. 7.5 milliliters. C. 10 milliliters. D. 12.5 milliliters. Correct answer, C. 10 milliliters. Rationale. 250 milligrams / 5 milliliters equals 50 milligrams per milliliter. 500 milligrams / 50 milligrams per milliliter equals 10 milliliters. Strategy. Shake suspension well before measuring. Why other options are not correct? A, B, underdose. D, overdose. Question 27. A client weighing 70 kilograms needs a loading dose of phenobarbital 15 milligrams per kilogram for. How many mg should be administered? A. 950 milligrams. B. 1000 milligrams. C. 1050 milligrams. D. 1100 milligrams. Correct answer, C. 1050 milligrams. Rationale. 15 milligrams per kilogram times 70 kilograms equals 1050 milligrams. Strategy. Administer slowly, monitor respiratory status closely. Why other options are not correct? A, B, underdose. D, overdose, risk of respiratory depression. Question 28. A provider orders lactated ringers 500 milliliters to infuse over 6 hours. The 4-tubing drop factor is 20 GTT/ml. What is the drip rate in GTT/min? A. 25 GTT/min. B. 28 GTT/min. C. 31 GTT/min. D. 34 GTT/min. Correct answer, B. 28 GTT/min. Rationale. 500 milliliters times 20 GTT/ml/ 6 hours times 60 minutes equals 27.8 is almost equal to 28 GTT/min. Strategy. Count drip rate for 1 minute to verify accuracy. Why other options are not correct? A. Too slow. C, D, too fast. Question 29. A child needs ondansetron 0.15 milligrams per kilogram for. The child weighs 20 kilograms. How many mg should be administered? A. 2 milligrams. B. 3 milligrams. C. 4 milligrams. D. 5 milligrams. Correct answer, B. 3 milligrams. Rationale. 0.15 milligrams per kilogram times 20 kilograms equals 3 milligrams. Strategy. Administer over 15 minutes to prevent headache. Why other options are not correct? A. Underdose, inadequate nausea control. C, D, overdose. Question 30. A client is prescribed levothyroxine 0.075 milligrams PO. Available, levothyroxine 75 micrograms tablets. How many tablets should the nurse administer? A. 0.5 tablet. B. 1 tablet. C. 1.5 tablets. D. 2 tablets. Correct answer, B. 1 tablet. Rationale. 0.075 milligrams equals 75 micrograms. 75 micrograms/75 micrograms per tablet equals 1 tablet. Strategy. Always convert units before calculating mg to make g. Why other options are not correct? A. Underdose. C, D, overdose, risk of cardiac symptoms. Question 31. A provider orders norepinephrine 8 micrograms per minute for. The concentration is 4 milligrams in 250 milliliters D5W. What is the flow rate in ml/hr? A. 25 milliliters per hour. B. 30 milliliters per hour. C. 35 milliliters per hour. D. 40 milliliters per hour. Correct answer, B. 30 milliliters per hour. Rationale. 8 micrograms per minute equals 0.008 milligrams per minute. 0.008 milligrams per minute times 60 minutes equals 0.48 milligrams per hour. 4 milligrams/250 milliliters equals 0.016 milligrams per milliliter. 0.48 milligrams per hour/0.016 milligrams per milliliter equals 30 milliliters per hour. Strategy. Monitor BP continuously during norepinephrine infusion. Why other options are not correct? A. Underdose. C. D. Overdose, risk of severe vasoconstriction. Question 32. A child weighing 30 kilograms needs 4 fluids at a maintenance rate. What is the hourly rate using the 4-to-1 rule? A. 50 milliliters per hour. B. 60 milliliters per hour. C. 65 milliliters per hour. D. 70 milliliters per hour. Correct answer, C. 65 milliliters per hour. Rationale. First 10 kilograms, 4 milliliters per kilogram per hour equals 40 milliliters per hour. Second 10 kilograms, 2 milliliters per kilogram per hour equals 20 milliliters per hour. Remaining 10 kilograms, 1 milliliter per kilogram per hour equals 10 milliliters per hour. Total, 40 plus 20 plus 5 is equal to 65 ml/hr. Strategy. 4-to-1 rule, 4 for first 10 kilograms, 2 for next 10 kilograms, 1 for each additional kg. Why other options are not correct? A. B. Underdose, risk of dehydration. D. Overdose, risk of fluid overload. Question 33. A client needs hydromorphone 1.5 milligrams for. Available, hydromorphone 2 milligrams per milliliter. How many ml should the nurse administer? A. 0.5 milliliters. B. 0.75 milliliters. C. 1 milliliter. D. 1.5 milliliters. Correct answer, B. 0.75 milliliters. Rationale. 1.5 milligrams/2 milligrams per milliliter equals 0.75 milliliters. Strategy. Administer slowly over 2 to 3 minutes. Why other options are not correct? A. Underdose. C. D. Overdose, risk of respiratory depression. Question 34. A provider orders magnesium sulfate 2G/HR4. The concentration is 20 G in 500 milliliters LR. What is the flow rate in ml/HR? A. 40 milliliters per hour. B. 50 milliliters per hour. C. 60 milliliters per hour. D. 70 milliliters per hour. Correct answer, B. 50 milliliters per hour. Rationale. 20 G/500 milliliters equals 0.04 G/ml. 2 G/HR/0.04 G/ml equals 50 milliliters per hour. Strategy. Monitor reflexes and respiratory rate hourly. Why other options are not correct? A. Underdose. C. D. Overdose, risk of magnesium toxicity. Question 35. A child weighing 22 kilograms needs vancomycin 40 milligrams per kilogram per day divided into 4 doses. How many mg per dose? A. 200 milligrams. B. 220 milligrams. C. 240 milligrams. D. 260 milligrams. Correct answer, B. 220 milligrams. Rationale. 40 milligrams per kilogram per day times 22 kilograms equals 880 milligrams per day. 880 milligrams / 4 doses equals 220 milligrams per dose. Strategy. Monitor trough levels and renal function. Why other options are not correct? A. Underdose. C. D. Overdose risk of nephrotoxicity. Question 36. A provider orders propofol 20 micrograms per kilogram per minute for a 75 kilograms client. The concentration is 1000 milligrams in 100 milliliters. What is the flow rate in ml/hr? A. 7 milliliters per hour. B. 9 milliliters per hour. C. 11 milliliters per hour. D. 13 milliliters per hour. Correct answer, B. 9 milliliters per hour. Rationale. 20 micrograms per kilogram per minute times 75 kilograms equals 1,500 micrograms per minute equals 1.5 milligrams per minute. 1.5 milligrams per minute times 60 minutes equals 90 milligrams per hour. 1000 milligrams / 100 milliliters equals 10 milligrams per milliliter. 90 milligrams per hour / 10 milligrams per milliliter equals 9 milliliters per hour. Strategy. Monitor sedation level continuously. Why other options are not correct? A. Underdose. C. D. Overdose risk of severe hypotension. Question 37. A client is prescribed atorvastatin 40 mg PO. Available, atorvastatin 20 mg tablets. How many tablets should the nurse administer? A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Correct answer, B. 2 tablets. Rationale. 40 milligrams / 20 milligrams per tablet equals 2 tablets. Strategy. Administer in evening for maximum effectiveness. Why other options are not correct? A. Underdose. C. D. Overdose risk of myopathy. Question 38. A provider orders epinephrine 0.01 milligrams per kilogram IM for anaphylaxis. The child weighs 15 kilograms. Available, epinephrine 1 milligram per milliliter, 1:1,000. How many ml should the nurse administer? A. 0.10 milliliters. B. 0.15 milliliters. C. 0.20 milliliters. D. 0.25 milliliters. Correct answer, B. 0.15 milliliters. Rationale. 0.01 milligrams per kilogram times 15 kilograms equals 0.15 milligrams. 0.15 milligrams / 1 milligram per milliliter equals 0.15 milliliters. Strategy. Use 1:1000 concentration for IM, 1:10,000 for 4. Why other options are not correct? A. Underdose, inadequate treatment. C, D, overdose risk of cardiac complications.
Question 39. A client needs famotidine 20 mg for.
Available, famotidine 10 mg per milliliter.
How many ml should the nurse administer? A. 1 milliliter. B. 2 milliliters. C. 3 milliliters. D. 4 milliliters.
Correct answer, B. 2 milliliters.
Rationale.
20 mg/10 mg per milliliter equals 2 milliliters.
Strategy. Administer over at least 2 minutes.
Why other options are not correct?
A. Underdose. C. D. Overdose. Question 40. A provider orders 1,500 milliliters NS to infuse over 10 hours. What is the flow rate in ml/hr?
A. 125 milliliters per hour. B. 150 milliliters per hour. C. 175 milliliters per hour.
D. 200 milliliters per hour.
Correct answer, B. 150 milliliters per hour.
Rationale.
1,500 milliliters/10 hours equals 150 milliliters per hour.
Strategy. Monitor for signs of fluid overload.
Why other options are not correct?
A. Too slow. C. D. Too fast, risk of pulmonary edema. Question 41. A child needs methylprednisolone 1 mg per kilogram for.
The child weighs 28 kilograms.
How many mg should be administered?
A. 24 milligrams.
B. 26 milligrams. C. 28 milligrams. D. 30 milligrams.
Correct answer,
C. 28 milligrams. Rationale.
1 milligram per kilogram times 28 kilograms equals 28 milligrams.
Strategy. Administer over several minutes to prevent arrhythmias.
Why other options are not correct?
A. B. Underdose. D. Overdose. Question 42. A provider orders metoprolol 5 mg for push.
Available, metoprolol 1 milligram per milliliter.
How many ml should the nurse administer? A. 3 milliliters. B. 4 milliliters. C. 5 milliliters. D. 6 milliliters.
Correct answer, C. 5 milliliters.
Rationale. 5 milligrams/1 milligram per milliliter equals 5 milliliters. Strategy. Administer over 2 minutes, monitor heart rate and BP.
Why other options are not correct?
A. B. Underdose. D. Overdose, risk of bradycardia and hypotension. Question 43.
A client is receiving lidocaine 2G in 500 milliliters D5W at 2 milligrams per minute.
What is the flow rate in ml/hr?
A. 25 milliliters per hour.
B. 30 milliliters per hour.
C. 35 milliliters per hour.
D. 40 milliliters per hour.
Correct answer, B. 30 milliliters per hour.
Rationale.
2 milligrams per minute times 60 minutes equals 120 milligrams per hour. 2G/500 milliliters equals 2000 milligrams/500 milliliters equals 4 milligrams per milliliter. 120 mg per hour / 4 mg per milliliter equals 30 milliliters per hour. Strategy: monitor for CNS toxicity, confusion, seizures. Why other options are not correct? A. Underdose. C. D. Overdose risk of toxicity. Question 44. A child weighing 16 kilograms needs lorazepam 0.05 milligrams per kilogram for seizure. How many mg should be administered? A. 0.6 milligrams. B. 0.7 milligrams. C. 0.8 milligrams. D. 0.9 milligrams. Correct answer, C. 0.8 milligrams. Rationale: 0.05 milligrams per kilogram times 16 kilograms equals 0.8 milligrams. Strategy: administer slowly, have resuscitation equipment ready. Why other options are not correct? A. B. Underdose, inadequate seizure control. D. Overdose risk of respiratory depression. Question 45. A provider orders cefazolin 500 mg for. Available, cefazolin 1g vial. Reconstitute with 10 ml sterile water for a final concentration of 100 mg per milliliter. How many ml should the nurse administer? A. 3 milliliters. B. 4 milliliters. C. 5 milliliters. D. 6 milliliters. Correct answer, C. 5 milliliters. Rationale: 500 milligrams / 100 milligrams per milliliter equals 5 milliliters. Strategy: infuse over 30 to 60 minutes to prevent thrombophlebitis. Why other options are not correct? A. B. Underdose. D. Overdose. Question 46. A client needs Alteplase 0.9 mg per kilogram for, max 90 mg, for stroke. The client weighs 110 kilograms. How many mg should be administered? A. 85 milligrams. B. 90 milligrams. C. 95 milligrams. D. 99 milligrams. Correct answer, B. 90 milligrams. Rationale: 0.9 milligrams per kilogram times 110 kilograms equals 99 milligrams. Maximum dose is 90 milligrams, always use the lower value. Strategy: never exceed maximum dose even if weight-based calculation is higher. Why other options are not correct? A. Underdose. C. D. Exceed maximum safe dose, increased bleeding risk. Question 47. A provider orders oxytocin infusion starting at 1 milliunits/min. The concentration is 10 units in 1000 milliliters Lr. What is the initial flow rate in ml/hr? A. 4 milliliters per hour. B. 6 milliliters per hour. C. 8 milliliters per hour. D. 10 milliliters per hour. Correct answer, B. 6 milliliters per hour. Rationale: 10 units equals 10,000 milliunits. 10,000 milliunits / 1,000 milliliters equals 10 milliunits/ml. 1 milliunit/min times 60 minutes equals 60 milliunits/hr. 60 milliunits/hr/10 milliunits/ml equals 6 milliliters per hour. Strategy: Monitor contractions and fetal heart rate continuously. Why other options are not correct? A. Underdose. C. D. Overdose, risk of uterine hyperstimulation. Question 48. A child needs azithromycin 10 mg per kilogram PO on day 1. The child weighs 18 kilograms. Available, azithromycin 200 mg per 5 milliliters. How many ml should the nurse administer? A. 3.5 milliliters. B. 4.0 milliliters. C. 4.5 milliliters. D. 5.0 milliliters. Correct answer, C. 4.5 milliliters. Rationale. 10 milligrams per kilogram times 18 kilograms equals 180 milligrams. 200 milligrams / 5 milliliters equals 40 milligrams per milliliter. 180 milligrams / 40 milligrams per milliliter equals 4.5 milliliters. Strategy. Give on empty stomach for better absorption. Why other options are not correct? A. B. Underdose. D. Overdose. Question 49. A client is prescribed nitroprusside 2 micrograms per kilogram per minute. The client weighs 60 kilograms. The concentration is 50 milligrams in 250 milliliters D5W. What is the flow rate in ml/hr? A. 30 milliliters per hour. B. 36 milliliters per hour. C. 40 milliliters per hour. D. 45 milliliters per hour. Correct answer, B. 36 milliliters per hour. Rationale. 2 micrograms per kilogram per minute times 60 kilograms equals 120 micrograms per minute equals 0.12 milligrams per minute. 0.12 milligrams per minute times 60 minutes equals 7.2 milligrams per hour. 50 milligrams / 250 milliliters equals 0.2 milligrams per milliliter. 7.2 milligrams per hour / 0.2 milligrams per milliliter equals 36 milliliters per hour. Strategy. Cover 4 bag nitroprusside is light sensitive. Why other options are not correct? A. Underdose. C. D. Overdose, risk of severe hypotension and cyanotoxicity. Question 50. A provider orders fentanyl 2 micrograms per kilogram for procedural sedation. The client weighs 55 kilograms. Available, fentanyl 50 micrograms per milliliter. How many ml should the nurse administer? A. 1.8 milliliters. B. 2.0 milliliters. C. 2.2 milliliters. D. 2.4 milliliters. Correct answer, C. 2.2 milliliters. Rationale. 2 micrograms per kilogram times 55 kilograms equals 110 micrograms. 110 micrograms / 50 micrograms per milliliter equals 2.2 milliliters. Strategy. Administer slowly over 1 to 2 minutes, monitor respiratory status. Why other options are not correct? A. Underdose, inadequate analgesia. B. Slightly underdosed. D. Overdose, risk of respiratory depression. And that's a wrap. Great job working through these questions with me today. Remember, every question you practice brings you one step closer to passing the NCLEX and becoming the nurse you're meant to be. If this video helped you, Don't forget to like, subscribe, and hit that notification bell so you never miss new content from Explain Wise 91.